lecture, we will learn about the therapeutic uses and the adverse effects of anti-diuretic peptides. The anti-diuretic peptides that are available for clinical use are vasopressin, desmopressin acetate, and terlipressin. Vasopressin is available as a sterile aqueous solution and can be administered intramuscularly, subcutaneously, and intranasally. Desmopressin acetate is also available as a sterile aqueous solution and can be administered intravenously and subcutaneously. It is also available for intranasal administration. It is available as tablets for oral administration. Terlipressin is a newer anti-diuretic peptide and can be injected into the vein. The therapeutic uses of anti-diuretic peptides can be categorized according to the action on vasopressin receptors. The vasopressin receptors are divided into two types, the V1 receptor and V2 receptors. The V1 receptor mediated therapeutic applications are as follows. The V1 receptors are predominantly present in the smooth muscles of the GI tract and blood vessels. So, stimulation of V1 receptors of the smooth muscles of the GI tract and blood vessels causes contraction. So, contraction of GI smooth muscles has various therapeutic implications. For example, they are useful in the treatment of post-operative paralytic ileus where they can increase the smooth muscle tone. Secondly, they can be used for the treatment of abdominal distension. Thirdly, by causing contraction, they can cause or dispel intestinal gas before radiography to avoid interfering gas shadows. So, by causing contraction of the GI smooth muscles, they can be used in various therapeutic purposes. Similarly, stimulation of V1 receptors of the smooth muscles of the blood vessels causes vasoconstriction and increased resistance in the systemic circulation. By causing contraction of the splanchnic blood vessels, it decreases the blood flow to the portal system and thereby it attenuates pressure and bleeding in the esophageal varices. Therefore, V1 receptor agonists by acting on the splanchnic blood vessels can be useful for the management of esophageal varices. But do remember that V1 receptors are also present in the coronary blood vessels, and contraction of the coronary blood vessels decreases the blood flow in the coronary circulation, and this can cause exacerbation of angina and cardiotoxic side effects. Therefore, to avoid or minimize the cardiotoxic side effects, the V1 receptor agonists are combined with nitroglycerin, an anti-anginal agent which increases the blood flow to the heart and reduces or attenuates the cardiotoxic side effects of the V1 receptor agonist and maximizes the beneficial effect on splanchnic circulation. Amongst the anti-diuretic peptides that are available for clinical use, terlipressin is the drug of choice in the management of esophageal varices. This is because terlipressin has increased safety compared to vasopressin, which is a short-acting agent and produces significant side effects. Therefore, terlipressin is preferred for the treatment of bleeding esophageal varices. So, what are the other therapeutic uses related to V1 receptor-mediated actions? For example, the use and the management of abdominal surgery in patients with portal hypertension, where they can reduce the risk of hemorrhage by causing constriction of the blood vessels through V1 receptor mediated stimulatory action. Thirdly, because vasopressin reduces bleeding, they can be used in a variety of hemorrhagic disorders to reduce the risk of hemorrhage. For example, they can be used in the treatment of acute hemorrhagic gastritis, cyclophosphamide-induced hemorrhagic cystitis, burn wound excision, cesarean section, dissection of myoma, and so on. Vasopressin can also be used for the treatment of vasodilatry or septic shock by causing constriction of blood vessels. Although norepinephrine is the preferred drug in the treatment of septic shock, it has been seen that vasopressin, when combined with norepinephrine, produces superior efficacy and produces better effect compared to vasopressin when used alone. Therefore, vasopressin can be combined with norepinephrine in the management of vasodilatory shock by causing V1 receptor mediated vasoconstriction and increasing the resistance in the blood vessels. So to sum up, the V1 receptor mediated therapeutic applications, they can be used for the management of various GI disorders, for example, post-operative paralytic ileus, abdominal distension, and to dispel intestinal gas before radiography. And whereas the V1 receptor mediated therapeutic applications related to blood vessels include the bleeding esophageal varices, several bleeding disorders, vasodilatory shock. So let's now move on to V2 receptor mediated therapeutic applications of anti-diuretic peptides. The V2 receptors are predominantly present in the kidney and more precisely in the collecting duct. Activation of V2 receptors in the collecting ducts increases the permeability of collecting ducts to water, thus causing increased reabsorption of water from the tubules into the interstitium, causing concentration of urine, decreasing the urine flow, decreasing the urine volume, and causing increase in urine osmolality. Therefore, anti-diuretic peptides are drug of choice in the treatment of diabetes insipidus, which is characterized by increased excretion of dilute urine, excretion of large volume of urine, more than 30 ml per kilogram per day, and the urine is dilute, that is less than 200 milliosmolar per kilogram. Thus, the anti-diuretic peptides are preferred drugs in the treatment of diabetes insipidus. Do remember that diabetes insipidus is of two types: central diabetes insipidus and nephrogenic diabetes insipidus. In central diabetes insipidus, the defect lies in the posterior pituitary where the vasopressin secretion is less. So there are low levels of vasopressin in the circulation, as a result of which there is impaired concentration of urine, leading to the excretion of dilute urine. In nephrogenic diabetes insipidus, the defect is in the kidney where the V2 receptors are non-functional. So because the V2 receptors are non-functional, even if the vasopressin levels are normal, the vasopressin is ineffective, fails to produce its anti-diuretic response. Therefore, anti-diuretic peptides are the mainstay treatment in the management of central diabetes insipidus and not nephrogenic diabetes insipidus. This is because administration of desmopressin can act on the V2 receptors of the kidney, causing concentration of urine and decreasing the urine volume and the urine flow rate. Whereas desmopressin, when administered in nephrogenic diabetes insipidus, the V2 receptors are non-functional. Therefore, the desmopressin action is ineffective. It fails to produce an anti-diuretic response. Therefore, anti-diuretic peptides are the drug of choice. They are the preferred choice in the management of central diabetes insipidus, where the V2 receptors are functional, and by acting on the V2 receptors, they cause concentration of urine. Whereas in nephrogenic diabetes insipidus, these drugs are ineffective because of non-functional V2 receptors. Secondly, anti-diuretic peptides can be used for the treatment of primary nocturnal aneurysms, where there is increased volume of urine or increased flow rate during the night time. So the anti-diuretic peptides, by producing the anti-diuretic action, reduce the urine flow, the urine volume during the night time, and is useful in treating primary nocturnal aneurysms. Thirdly, anti-diuretic peptides can be useful in the management of post-lumbar puncture headache. This is because of increased retention of fluid and rapid equilibration of fluid in the central nervous system. Therefore, anti-diuretic peptides, by causing anti-diuretic action, water retention, they cause equilibration of fluid in the central nervous system and relieves post-lumbar puncture headache. So, to sum up, the V2 receptor mediated action on the kidney, which causes renal water conservation and treats central diabetes insipidus, primary nocturnal aneurysms, and is also useful for treating post-lumbar puncture headache. The next category of V2 receptor mediated therapeutic applications are the V2 receptor agonists increase the release of coagulation factors such as factor 8 and von Willebrand's factor. Because they release factor 8 into the circulation, they can be useful for the treatment of hemophilia A, which is characterized by a deficiency of factor 8. So it is not used for the treatment of hemophilia B, which is characterized by factor 9 deficiency. Secondly, V2 receptor mediated stimulation also causes release of von Willebrand's factor, and therefore anti-diuretic peptides can be useful for the treatment of type 1 von Willebrand's disease, but it is not used for the treatment of type 2b von Willebrand's disease because it causes transient thrombocytopenia. The other therapeutic applications are V2 receptor agonists can be used for the management of hemostatic abnormalities induced by uremia in patients with renal insufficiency. Anti-diuretic peptides can also be used for treating bleeding disorders that are induced by liver cirrhosis and several drugs that cause decrease in the concentration of coagulation factors. So V2 receptor mediated therapeutic applications include management of hemophilia A, von Willebrand's disease, hemostatic abnormalities, and certain bleeding disorders. We now shift our attention to adverse effects of anti-diuretic peptides, which are mediated through V1 receptors and V2 receptors. The V1 receptor mediated adverse effects are as follows. As mentioned earlier, the V1 receptors are present in the blood vessels, and the stimulatory action on V1 receptors causes constriction. So V1 receptor mediated constriction of the cutaneous blood vessels can cause marked facial pallor. So large doses of vasopressin can cause facial pallor due to cutaneous vasoconstriction. Similarly, contraction of the smooth muscles of the GI tract can cause increased intestinal activity causing belching, intestinal cramps, and an urge to defecate. Also to be kept in mind that the V1 receptors in the coronary blood vessels can decrease the coronary blood flow, and this can cause exacerbation of angina. Therefore, these drugs should be administered with caution in patients with coronary artery disease. The other cardiac complications are decreased cardiac output and arrhythmias. It has been seen that large doses of vasopressin can cause increased peripheral vasoconstriction and gangrene, and this has been encountered in a large number of patients. This is because of vasoconstriction and increased resistance in the blood vessels, and particularly in the peripheral circulation, this can cause gangrene. The next group of adverse effects are V2 receptor mediated adverse effects, and as we know that V2 receptors play a very important role in renal conservation of water, increase reabsorption of water, and increase in expansion of extracellular fluid volume. Because these drugs can cause increased expansion of extracellular fluid volume, these drugs should be administered with caution in disease states that cause rapid increase in extracellular water, for example in hypertension, angina, in congestive heart failure, which is manifested by congestive symptoms. So these drugs should not be administered in heart failure, which is characterized by congestive symptoms. Because vasopressin and desmopressin increases the reabsorption of water and causes expansion of extracellular fluid volume, there can be dilutional hyponatremia, and this is manifested by symptoms of nausea, muscle cramps, and CNS manifestations such as confusion and coma. So plasma hypotony can cause the influx of water into the brain cells, causing CNS manifestations. Thirdly, these drugs should not be administered in patients with primary or psychogenic polydipsia, because these drugs have a tendency to cause water retention, and therefore the extracellular fluid volume is high, and therefore they should be administered with caution, and the patient should be advised to reduce the fluid intake. So to sum up the V2 receptor mediated adverse effects, V2 receptors play an important role in renal water conservation, expansion of extracellular fluid volume, decrease in plasma osmolality, and dilutional hyponatremia. Therefore, these drugs should be cautiously administered in congestive states such as congestive heart failure, hypertension, and also should be cautiously administered in patients with primary or psychogenic polydipsia who take a lot of water, and the patient should be advised to reduce the fluid intake.
This brings us to the end of the topic. These are my references. Thanks for watching. Please like, subscribe and share.